Joining our first wellness webinar here at CHI Health. Well, life has changed quite a bit since the beginning of COVID. Now going into the holidays, we have many questions about how to celebrate safely, eat sensibly, and not pack on the pounds as we enjoy our favorite holiday goodies. There are also a lot of questions about COVID-19 in general, about the virus, about the vaccine. And we have several experts here today to answer your questions and more. We have infectious disease experts, diet nutritionist experts, mental health and fitness. But before we get started, I just want to remind you of a few things. You can ask us anything throughout the Q&A, throughout the webinar in the Q&A function, and that is located at the bottom of your screen. We're going to be answering your questions live, so send those in. You can ask questions on the diet, exercise, mental health, COVID. Again, all those experts are here to answer those questions. Now, this webinar is being recorded, so if you can't watch the whole thing or you have to pop in and out, we will be posting this online. Look out for that link throughout the webinar as well. And make sure you stay with us for a chance to win a Fitbit Inspire 2. 5 lucky winners will be taking one of these home. Again, we're going to announce those names throughout the webinar today, so be sure to stay tuned. Well, let's go ahead and jump in. Joining me live here is CHI Health infectious disease expert, Dr. David Quimby. Dr. Quimby has largely led our COVID care here at CHI Health, and he's here to answer several questions about the virus and how we celebrate the holidays safely. So let's go ahead and dive in. I do have, we're first going to talk about the vaccine, Dr. Quimby. So there are a lot of things in the news right now about that vaccine. I believe Pfizer announced that they have one that's relatively ready to go. Can you talk about where we're at with that, what this announcement means, maybe some of the things that we still have to get to before it's approved and available to the public?
Okay, thanks for having me. With the Pfizer vaccine, I would say I'm cautiously optimistic. Keep in mind what has been put out there was a release from the company. The actual data, at least as of 3 or 4 hours ago, when I started my workday, had not been released for independent analysis. But if they're reporting a 90% success rate with approximately 80 to 85 people who had contracted infected in COVID infections, that means that less than 10 got infected, as opposed to the vast majority who didn't get the vaccine, had most of the infections. There are several things we don't know, how long that will last. Various other vaccines, you have to have a booster every so long or your immunity starts to wane, and it's way too early to know anything about that. There's also, how does the average person get a vaccine? Right now, they have not even applied for what's called an EUA, or an emergency use authorization. That's where they present information to the FDA saying, hey, we have this, we think it's good, but the full data isn't necessarily there yet. And the FDA can look at it and decide if it's worthwhile to use in emergency situations, like a pandemic, okay? So once they have enough data on safety, which is enough people being so many months after receiving their vaccines, then the FDA will decide if it's going to give an EUA or not. That's different than full FDA approval, for which you need a lot more information. This vaccine has to be kept really, really cold in order to continue to work. So there has to be distribution network in place, which has been being worked on by various states along the way, so it wouldn't be a last minute thing. Average person, not a frontline worker, which frontline workers include people in hospitals, and even I would consider people in grocery stores, convenience stores, restaurants, might not be able to get the vaccine until sometime next year because they have to produce more and be able to get it out there.
Mm-hmm. And I did want to mention quickly, Dr. Quimby and I are spaced 6 feet apart. That's why we're not wearing masks. But everybody else here in the room today with us has a mask on. We're all socially distanced, and we're not going to be seated next to each other for longer than 15 minutes. So taking all the precautions, which is something obviously that you have helped us guide us through during this process, Dr. Quimby. So thank you. Jumping back to the vaccine, we do want to talk about what this means exactly. I mean, I know you mentioned it could be a while before the general public is available to get it. But does this announcement mark any sort of progress for the infectious disease world or the public in general?
Sure, because before they started the large trials with the vaccines, they knew that pretty much all of them made an antibody response in the volunteers who took the vaccine. But that's great. There's a difference, though, between an antibody response and actually not getting sick. So by having some phase 3 data, which is a large scale, it showed that people who received active vaccine we're actually less likely to become ill, which is assuming the data is borne out after it's reviewed.
What could a timeline for distribution? I mean, I know you talked about it a little bit, but what can people look forward to? Is there a date, that we can say, hopefully we'll have a vaccine by this time? Or is it really just kind of taking it a day at a time and seeing where we're at?
I would say, honestly, take it a day at a time, see where we're at, let the data be reviewed, because you do not want to mass distribute a vaccine that could have some safety issues or something like that. And if they apply for an EUA and get it in November, and the infrastructure is there, it could hopefully start being distributed to the first line individuals in December and January, and then hopefully other people later on as more becomes available.
Okay, we're going to move on to our holiday questions and how we can celebrate the holidays safely. I know that's something that's on the minds of many, including mine. With Thanksgiving coming up, can I have my family over? If I have a large family, what's a safe number?
If you want to be perfectly honest here, the safe number is one, you. Okay, the more people you have together, the better chance you have of somebody being asymptomatic or pre-symptomatic and infecting other people. In the last few months, the CDC has come out with data that most of the spread is not necessarily from super huge, large gatherings, but if you look at actual numbers from smaller gatherings in homes or smaller gatherings between homes, which is exactly what holiday meals are.
Okay. Again, you can submit your questions live. I have an iPad here where I'm monitoring them, so please do submit your questions if you have them. How do we eat and stay 6 feet apart? Is that possible? Can we sit at the same table?
Well, in those movies, a really long tables. Okay. Eating is not considered the safest activity because you do not have a mask on while you're eating. So if you're at a standard table and you're sitting next to somebody, that's not considered safe unless they're part of your inner circle, like your household where you always have contact with them. So having people from out of your household eating at the same table with you is not considered the safest of activities. By definition, it would be considered an exposure because your standard meal for a holiday is more than 15 minutes.
So a lot of people traveling for the holidays. Say my kids are flying in. Do they need to quarantine? And if so, how long?
Quarantining before you leave for the trip would not be necessarily all that helpful because then you have the airport, you have the airplane, and then the disembarkation type of thing. There was a recent study I read, I think it came out over the weekend or I read it over the weekend about in-airplane transmission, which might not be as bad as people think it is. But it was a study, not a real world situation, where there was a mannequin putting out puffs of aerosol every so many times a minute, like someone breathing. And then they saw how much aerosol they could get in other parts of the cabin. And it wasn't as bad as they feared. But that is an airplane in flight, not the airplane sitting on the jetway for 30 minutes waiting to take off, not you standing in the security line waiting to get screened, and not you sitting at baggage claim. If you were quarantined and then you were exposed in the airport, you could theoretically infect other family members a day or two or three after you arrived at your destination.
Mm-hmm. Switching back to celebrating with family, let's talk a little bit more about elderly family members, inviting grandma and grandpa to the Thanksgiving celebration as you typically would, or maybe they host it, but you don't feel like that's a safe thing this year. What recommendations do you have there? Is it safe to celebrate with the elderly?
This is hard because you might not have seen these family members for a long time. And if you're mentioning elderly family members, honestly, I don't know their health. I don't know how many more holidays that you can have an actual gathering. So just having a blanket, no, you're not celebrating, is not necessarily the safest thing to do. There are some things you can do to try to mitigate the risk. People don't all have to eat together. You can separate who's eating at a certain time. If they are visiting your home and they're not part of your home, people can have masks inside their house. There's no rule saying that you can't have masks in your house if you're around other people who are not part of your household. And that can help limit the risk. It doesn't make it to zero, but simple things like that can help limit it.
Okay, you just mentioned precautions and we had a question come in live. Can we have separate tables for each family and wear masks the rest of the time and still be safe for Thanksgiving?
Safer, okay? because the only pure safety is you by yourself in the middle of a forest with nobody around you for a mile, which is not very realistic. So you try to do what is safe as possible, as in not eating right next to somebody else, masking when you're in the home if they're not part of your home. Make sure your mask is on properly. People actually do most of their breathing through their nose. So if your nose is hanging out, you might as well not be wearing one. Those type of things make it safer. Not zero, but can be much safer.
You talked a little bit about travel, and I want to go back to that. We've heard a lot of things about nose spray before flying. Does that lessen your chances of getting COVID?
I actually read one study this weekend about ferrets, and ferrets are a good model for COVID.
Don't you have a ferret?
We had a ferret.
Oh, I'm sorry.
Rest in peace, Finn. And they're a good model for COVID for a few reasons. But with a certain protein spray that they could get, which tended to block transmission. That is nowhere near human studies yet. So I'm assuming this is talking about like normal moisturizing nose sprays. That can keep your nasal mucosa healthier, so maybe less likely to get infections in general. But I would not put my safety on a bottle of ocean nose spray.
Okay. We also have heard a lot about zinc and vitamin D. Will those keep you from getting COVID or sick during the holiday season?
Most people are not zinc deficient, so you don't necessarily need supplementation. There are data with other viruses like cold ease lozenges where you can decrease how sick you are if you start taking it as soon as you become ill. There are no data on that for COVID to my knowledge at this time. Vitamin D, a lot of people here in Nebraska area tend to be deficient come wintertime because it's always cloudy and they're not outside. Vitamin D is involved with the immune system. So if you are vitamin D deficient, you might be more prone to getting infections. You can overdose on vitamin D, so don't take it willy-nilly, but a little supplement of that, there's no strong evidence it would be helpful, but it is likely not going to hurt and might have some benefit. Don't overdose on it though.
We're kind of jumping all around as questions come in here live, but is it safe to have elderly family members visit if they live in assisted living?
First thing I would do is check with the rules of the assisted living, because different places are different and they might have rules about them being allowed to leave the facility because they don't necessarily want to bring things into their facility. The biggest risk would be how much of a community setting there is at the assisted facility if things are brought in there. So follow their rules there. But otherwise, it would be the same risk for them as any other family member, to where is it worth the benefit for the risk you're taking?
Back to the vaccine now. Dr. Fauci said a successful COVID vaccine would have major impacts on everything we do with respect to COVID. What would those impacts be and look like? How would a vaccine change things?
A vaccine would change things because once it is out there and once enough people have taken it and once people have more immunity, you will stop having the market increase in number of people who have infected and number of people in hospitals. The main driver of all of the health measures and everything put into place is to try to keep too many people from being in the hospital at one time, because then you can't take care of them. So if we have people who are not likely to be in the hospital because the vaccine either prevents them from getting ill or prevents them from having more severe illness if they do become ill, we don't know if that happens yet, they haven't released that little bit of information, then you need less health measures because you're not going to have the overwhelming bloom of people filling up hospitals.
Back to Thanksgiving. If I test positive for COVID-19 a couple weeks before Thanksgiving, but receive a result saying I no longer have it, is it safe to be with my family, especially grandparents?
Repeat testing is generally not recommended to know if you're able to transmit it to somebody else at this time. If you're normal, good immune system, and you've had more than 10 days from the onset of your symptoms, it's felt you're pretty much unlikely to be able to spread it. There are some caveats in there to where if you don't have a good immune system, or if you receive some steroids or something like that to help you through, you were sick enough to be in the hospital, that maybe you can spread it longer than those 10 days. But I would ask with that gathering, you might be okay to not to spread it, but if there's 8 other people there, you don't know everybody else's situation and what they may be bringing in. You might not be able to catch it, but your friend Mary might be able to pass it along to your other friend Bob who's visiting.
If you test positive for COVID, we know a lot about antibodies, and obviously that those can help fight the virus off again. But if you test positive for COVID once, are you then immune?
Again, this question has been coming up since March. Ask again in a year. We do have clear evidence that some people have been infected more than once. Is that common? Right now, it does not seem to be common, and we don't know how long immunity lasts. Unfortunately, something like measles, where you get a vaccine or actual measles and then you're immune for life, tends to be not the norm with a lot of respiratory type of infections. So we don't know how long it's going to last. At least it's looking like at least 3 months or so, perhaps longer, but there's really not enough information to give a good answer to that other than, I don't know.
We have time for one more question before we switch gears. How many units of vitamin D is recommended for someone?
First answer is always talk to your general doc about that, okay? Because they know about your own particular health situation and that kind of deal. If you're very deficient, you get a lot more than somebody who is not deficient. But a standard dose of 2,500 units per day of D3 is likely to not get people into trouble. But I'd recommend talking to your own health provider about that.
Wanted to ask, if I'm sick, or even if I'm not sick, how many times should I be changing my mask or washing my mask?
First, I would say if you're not sick and just out and about, there's no real clear guidelines on this, and it really depends if you're using the disposable masks or a reusable cloth mask. If it's a disposable mask and it gets wet or anything like that, it's considered no good and needs to be changed. If it's a cloth mask, you should probably do it at least at the end of the day, chuck it into the washing machine. So it's good to have a few to rotate through. If you're sick, ideally, you're not changing a mask at all because you're staying home and not needing to wear a mask.
Right. Another question submitted live. Do we know anything about how COVID affects pregnant women?
Again, relatively new virus, all right? But from what we have seen so far, unlike some other infections, it doesn't seem to be worse in pregnant women than in non-pregnant people.
How do you handle people who want to hug you or who won't wear a mask in your home? What is a polite way to remind them to back off?
Well, nobody ever wants to hug the infection guy, so not an issue. If they do not live in your home and they do not want to wear a mask in your home, they do not necessarily have to be invited into your home. Okay. There are little social cues that you can have for people who are more demonstrative of their affection than other folk. A lot of that's just innate and part of your normal self. And apparently I send off like anti-hug vibes because nobody ever tries. But you can just like lean back, step back, and people pick up on that cue.
Can UV light revitalize masks? I bought one on Amazon recently.
Ultraviolet light can work to sterilize things, and at hospitals that reprocess their N95 masks, it can be used to sterilize it. However, there are checks with that you can use to make sure it's actually being sterilized, which you're probably not going to be able to do in the home environment. Also, without knowing what was purchased on Amazon, I don't know if there's adequate UV in that. However, for standard home use, a simple cloth mask is fair, and you don't need special precautions. You can put it in the laundry or hand wash.
If you test positive for COVID-19, how do you keep others in your home safe? I know I've heard some cases where some people in the home get it and then others don't, even though they're living in the same space. So what are your tips there?
Well, one problem is if you test positive today and you institute all these measures and maybe even never go home, that doesn't do anything for 2 or 3 days before, where you might have been able to still infect them. But ideally, you want to just stay as far away from them as possible. Everybody's home is different. So you might not have your own bedroom or your own bathroom. You just need to try to separate as much as possible. Ideally, sleep in your own room. ideally wear a mask yourself in your own house at all times, which is why it's important to sleep in your own room, because you should not be sleeping with a mask. If you have one kitchen, I mean, hey, you're sick, maybe somebody can bring the food to you in your room so you don't have to go into the common areas as much.
Yeah, wouldn't that
Okay.
be nice?
Yeah.
We see doctors like yourself using hand sanitizer before taking off masks. Do you recommend we do the same? I see so many people pulling masks off right as they leave the store.
Right. It's a slight difference where you are a hospital versus community environment, but the ideal situation is you would consider the outer surface of the mask as contaminated. So if you're going to be touching that, you would want to have your hands cleaned afterward. And also, anytime you're bringing your hands up to your face, it might be a good idea to have them clean. So if you have a little portable hand sanitizer, it's always useful to do that before putting on or taking off your mask anyway.
I have to ask you this because you're always very honest and we always appreciate that about you. What are you doing for the holidays this year?
Well, I usually work on Thanksgiving because up until this year and last year, I made the schedule, and that way I don't work Christmas.
Well,
Okay.
but if you weren't working Thanksgiving,
Okay.
how would you celebrate?
All right. Generally, what happens is because I'm working Thanksgiving and I feel a little bit guilty about working and not being at home, my wife and our kids will go visit my in-laws in Kansas City. It's not I'm trying to avoid them. I like them. Okay. But they're not doing that this year. We're staying home. Usually around Christmas time, my father-in-law will come up to visit with us, and that is not going to be happening this year. We are staying home.
Another question that came in, school districts are experiencing COVID-19 outbreaks. Do you think it's necessary to test entire schools or even entire districts?
That would be a very awesome thing if we had the capability. I don't think there is the capability to test that many people. Most of the information that I have is from my child's school at Papillion School District, and they're actually doing pretty well, probably because all of the kids there are wearing masks. From what they're finding, at least what they're releasing to us, most of the cases there are brought into the school and not necessarily spread a whole lot inside the school. So behaviors outside of school doing well can try to keep it out of the schools.
This is the last question that we have time for, and I love that I'm asking you this because you always have your Hydro Flask or your bottle of water. And I always see you removing your mask to drink it. So how do you feel about the masks that allow you to sip through a straw?
Okay. My cup has a straw. My mask does not have a hole. A mask that has a hole is not much of a mask at all. Is it possible to have overlapping layers so that there's not a lot of airflow in there? Sure. Okay. I would have concern though, if you consider the outside surface of your mask is contaminated, you're rubbing this straw over this potentially contaminated surface and chucking it straight into your mouth.
Always a wealth of information, Dr. Quimby. So thank you so much for being here. We really appreciate it. And we want to thank all of our experts today who joined us. And we hope that you were able to take something helpful away, a tip or two that will help you navigate life during this challenging time. And if you missed any part of this presentation or want to watch it again, share it with your friends and family. It will be posted online at chihealth.com/wellness-webinar. So thank you so much for joining us. We hope you have a happy and safe holiday season and you stay healthy.